It is a season a lot of people dread, maybe you too. It can be confusing and time consuming.
Oh yeah, we're talking about open enrollment. Now when it comes to Medicare, senior citizens only have until this Saturday, December 7th, to make any changes to a current plan. But going through any healthcare coverage information can be overwhelming. In today's Angie's List report, how to be proactive when picking a plan.
Changes in healthcare have put us in the driver's seat. Now is the time to do your research, weigh all options, and pick a health plan that's right for you.
Taking advantage of the open enrollment period is a time for you to evaluate what your insurance covers and make sure you assess what needs you're going to have over the next year. So if you need to make changes to your insurance, you can do it now before it's too late.
When Charlie Klump turned 65, she learned her physician's practice didn't accept Medicare. After paying for a couple of office visits out of pocket, Klump decided to switch doctors. Now, she always checks with doctors before scheduling an appointment.
I called, talked to the business office and said, now I am a Medicare patient. That's my primary. I have a secondary insurance. But will you file that for me? Do you have any concerns about taking on an additional Medicare patient?
One thing many people overlook is whether their doctor is going to continue to accept their insurance. So while you're evaluating insurance, be sure you have a conversation with your doctor, especially if you're in the midst of a longer-term treatment plan, to be sure that you're still going to be covered, because the last thing you want to have to do is change your doctor in the middle of treatment because of an insurance issue.
If you don't understand what your plan does and does not cover, you could end up spending more money. Don't assume the plan and policy that you had this year will still cover your needs next year.
The biggest mistake people generally make when they're buying insurance is not knowing what they're looking for. People know they need it, and now they have to get it per the new laws, but they don't have an idea of exactly what they're looking for, and often when they purchase it, they don't understand what they have.
Take a look at what you spent last year in premiums and out-of-pocket expenses and compare that to what you expect to spend in 2014. If you don't understand your healthcare options, don't be afraid to ask questions. Sit down with your benefits person at work or talk with a financial planner or insurance broker.
We can shop every single insurance company licensed to do business in your state. We can, recommend plans and give you pros and cons of each. And brokers are paid actually and compensated by the insurance companies themselves. So there's no fees or service charge to work with a broker. And we can just make the whole process a lot more smoother, more efficient, and just make the whole process a lot easier on you.
Now, before you make your choice, the National Association of Insurance Commissioners has some suggestions for you. Check to see if your current physicians and area hospitals are in the plan's network. Using network providers generally will save you money on your health care. Check to see if spouses or dependents are covered. Some plans will cover spouses and other dependents, while other plans will not. Read all of the plan materials thoroughly. Doing so will tell you what your rights and responsibilities are under each plan. Now, if you take prescription medications, check them against the list of approved drugs in each plan booklet. Review any pre-existing condition exclusions and prior authorization requirements in the plan materials. If any part of a plan is unclear to you, ask for help from your Human Resources Department or the insurance carrier. And if you are not satisfied with the answers to your questions, contact your state insurance department. Angie's List says if you decide to work with an insurance broker who's an independent agent, you'll want to make sure he or she has the necessary credentials and is appropriately licensed. Requirements vary in each state, but generally insurance agents must pass an exam to become licensed and certified.
I can't even imagine trying to do this on your own without somebody's help. Now, as we mentioned earlier, time is running out for Medicare open enrollment, okay? It ends this Saturday, December 7th. That means you have until then to review, join, or compare your Medicare plan. Now, you may be confused regarding which plan is best for you. In general, according to Medicare.gov, Medicare Part A covers hospital care, skilled nursing facility care, nursing home care, hospice, and home health services. Part B generally covers medically necessary and preventative services. Things like clinical research, ambulance services, mental health services, and limited outpatient prescription drugs would be covered under Medicare Part B. Part C, or the Medicare Advantage plan, is offered by a private company that contracts with Medicare to provide you with all Part A and Part B benefits. Most Medicare Advantage plans offer prescription drug coverage. Medicare Part D is the prescription drug coverage and is available to everyone with Medicare. Now, with this coverage, you've got to join a plan run by an insurance company or other private company approved by Medicare. Now, keep in mind, each plan can vary in cost and drugs covered. So when it comes to Medicare, there is a lot of information to it. If you'd like to read more about it, including the pricing information or just for a link to enroll, you can go to delmarvalife.com and click on the Show tab.
All right. Well, something else that can be frustrating to figure out: Christmas gifts for everyone. But if you have little ones on your list, we're going to show you how easy it can be to get the best deals on the toys they want this holiday season.
And maybe you have that child who wants this, who wants that, who wants everything. We're going to find out how to ease their expectations come Christmas. But first, we just learned about open enrollment. Now, let's learn more about the Affordable Health Care Act. Dr. Oz tells us what's covered.
Hi, I'm Dr. Oz. Did you know that the Affordable Health Care Act requires many plans to cover certain preventive screenings at no cost to you? These include cholesterol tests, colonoscopies, and vaccines. Also, preventive services for women like cervical cancer screenings, mammograms after 40, and domestic violence counseling.